Callback appointments are common after a mammogram. As scary as it is, the information you will learn in this video can help relieve your concerns and offer hope. Facing a callback creates an unsettling feeling that can be difficult to ignore, but the statistics are on your side. In all likelihood, you do not have any health issue that requires treatment. We are going to take this callback appointment seriously, so you are well prepared. Please look at the mammogram image on the screen. Are you able to identify the cancer? It is a little bit difficult because it looks like just a bunch of dots. Maybe it is because you are not a trained radiologist. Very unfortunately, many radiologists only review enough mammograms to meet the minimal requirements to stay current in a 2-year time frame. That means he or she is not considered a mammography image expert. It is part of the reason the U.S. has such an astounding amount of incorrect breast cancer diagnoses and so many callback appointments. Learning how to handle the appointment may provide some small amount of relief. Let's begin with step 1. Take someone with you to the appointment. This will accomplish 3 goals. First, you will have emotional support. Second, both of you can be writing down what the doctor is telling you. And third, the person going with you should be aware of what you want to accomplish during that appointment. That way, the person with you can recognize when to speak up to you during the appointment if it is not going as well as you had planned. Decide on a safe word or sentence to help redirect and refocus on the questions that are important to you. For example, the conversation is clearly upsetting you and your friend says, "Hey, wait a minute. Do you understand that information, beauty queen?" The safe word is beauty queen, so that you can take a breath and get back to your list of concerns. Step 2. Understand and memorize this statement. You do not have to commit to anything during this appointment today. You can take your time to think about it, research it, get a second opinion of your mammogram. The mammogram images belong to you, not the doctor or the health facility. This is your life, your decision, and your responsibility. Before you go for the recall appointment, practice saying, "No, I do not feel comfortable making a decision right now." Or, "No, I am not going to schedule anything today. I need to think about it." You can tell your physician that you do not feel comfortable making a decision without talking to your family and doing some research. Step 3. Communication. The best relationships have one thing in common, and that is communication. The discussion about your mammogram is a 2-sided conversation. It should not be the physician telling you what to do next as a 1-sided conversation. It takes both of you to solve this situation for your benefit. You can practice saying something like, "I am scared and skeptical, so you and I need to work together as a team to find a solution." You need to be honest with them. This is your life and your health and your financial situation. If you are not convinced this is the right approach and you need more information, simply let them know that, because communication and honesty are the best approach. 4. Ask to see your mammogram images. Are they blurry, or do they look like the image at the beginning of this video with a bunch of dots? Can you identify the tumor or the area of concern looking at the image? If a copy of the image is not there, ask how you can get a copy. Sometimes the physician only has a written report. Viewing the mammogram yourself will provide instant information, because a picture is worth 1,000 words. When people are told they have cancer, sometimes the medical team expects them, without any doubt, to believe everything they say. Breast cancer is real, but is severely overdiagnosed. Just because the physician says that you have breast cancer does not make it true. A mammogram is never proof of breast cancer, never. A mass on the image could be a benign tumor. Express your concerns about repeating the same procedure. Here is why you may want to refuse a second mammogram. If it is indeed a cancerous tumor, you do not want to risk it rupturing during another compression mammogram and causing the cancer to spread. You already sustained a recent mammogram. Clearly state your concerns over repeating the same procedure by asking some of these questions. If the mammogram did not produce a clear enough image the first time, why would a second one be better? What about a sonogram instead? Or skip directly to a biopsy? Step number 6. Ask the physician to speak with you about a biopsy procedure. Write down the information. Where exactly is the questionable tissue located? How deep is it? What size is it? Where would you have to go for a biopsy? How long does it take? How quickly will you get the results? Do you need to take time off work for a biopsy to be performed? Step 7. Ask them directly, are you requesting a biopsy? If they say yes, you can tell them you will call back to schedule after you have had more time, but will take the referral slip along with you. If they reply no, ask why so you can understand the physician's approach. Ask if a blood test or any other test will be ordered to perhaps review your red and white blood cell count and the status of your lymphocytes. Cancer at any actionable level will most likely show elevated levels of white blood cell count and lymphocytes in your blood. You may wish to look up information about these two components online before the appointment to become acquainted with their purpose. You can leave the appointment with a referral for a blood test and a biopsy to eliminate the hassle and the anxiety of having to go back for the referral slips in the future. Step number 8. Summarize the conversation and ask if you missed anything. Physicians have a way of making clients feel pressured into making a choice to do something at that time. It does not matter who you are. Doctors are great at getting what they want from their patients. Being aware of this information helps you realize that you must keep the conversation on track, so when you leave, it was a positive appointment. You know what options are available, what to research, and you are comfortable that your list of questions have been answered. Being asked to make a decision over a major health concern after a brief 10-minute conversation in a physician's office is simply a ridiculous request. Yes, we want to work with our physician and respect them, but it is important to recognize that your physician is not in control of your health. They are hired and paid by you to give an educated opinion. Period. They are not your friend. They are not even your advocate. You pay them and they work for you. Did you know that 89% of patients go for a second opinion? They inherently disagree with the diagnosis or treatment being recommended by their physician. If you are uncomfortable moving forward with the physician you have, find a new one, because a health concern of this magnitude is very serious. Even if you do not have cancer, you want to feel comfortable with the person you are relying on for good information. You do not owe your physician anything. They are the person you hire to help you navigate your health concerns when they arise. You should have a level of comfort with their approach to this situation and all others. In 2013, ABC News produced a segment titled, "Always Get a Second Opinion on Breast Cancer Diagnosis, Experts Say," and the link is listed at the end of this video, so you can watch that segment. Step 9. The last thing you want to ask before ending the conversation is this: after these additional tests, where will I find the conclusive evidence that this is or is not cancer? What is the name of that report, please? And will my insurance still pay for treating me if cancer is not proven? This is why those questions are so valuable. After a double mastectomy, chemotherapy, medications, hospital stays, and there is no proof of cancer, who is responsible for paying the $125,000 medical bill? You would be surprised how many women receive an astronomical bill for medical services that were denied by the insurance company because there was no evidence of cancer. So the surgery, chemotherapy, medications, and hospital stay is considered an elective procedure performed without a medical cause. Before any major procedures concerning breast surgery, consider doing your own homework and speak with your insurance company directly about coverage, so there are no surprising medical bills. Step number 10. This one is for you. With the overdiagnosis of breast cancer in the United States, please do not fall into the erroneous assumption that because someone in your family had breast cancer, that you are more likely to get it. That is not a true statement. Turn your angst and your uneasiness about this breast cancer situation into empowerment. Share this video with the person going to the follow-up appointment with you. That way you are both approaching the appointment with the same outlook. Together you can get through this uncomfortable situation and be stronger, more informed, and ready to help the next person in your social circle enduring the same situation. Finding a cure for breast cancer is as basic as refusing to become a statistic. Nearly 60% of all breast cancer diagnoses require no medical attention at all. Women endure unnecessary surgery, chemo, radiation, financial hardship, and years of follow-up prescription medications for an issue requiring no treatment. When you decide the only way you will move forward with treatment is through undeniable proof of cancer, you become the catalyst to end the repressive action against women and erroneous breast cancer diagnoses. We can save some lives, even if it is just one at a time. Every life is precious, especially yours. Wishing you the very best. Just think about it.
The content of this video contains the author's opinions, observations, thoughts, conclusions, and serves as informational and educational material purposes only. It is not intended as medical advice, medical diagnosis, or medical treatment. The author is not prescribing medical treatment nor attempting to negate current medical treatment. Should viewers choose to follow any of the author's recommendations without the supervision of a medical doctor, they are doing so at their own risk. Should viewers decide to implement any of this information in the video, they are solely responsible for any outcome. The statements have not been evaluated by the Food and Drug Administration. The products mentioned in the video are not intended to diagnose, treat, cure, or prevent any disease.